Hey, I'm JT Tokish, and I'm one of the newest sports medicine surgeons here at the Steadman Hawkins Clinic of the Carolinas, part of the Greenville Health System. Recently joining and coming in from Hawaii most recently. I do mostly shoulder and knee, but I do all of sports medicine and have been practicing for, 15 years now. I was born actually in the Philippines and then moved back to Seattle, and then my family actually moved out to Guam, out in the Pacific Islands, where I spent my early formative years growing up. My dad was an engineer and worked out there. Moved back to Seattle, and then I joined the Air Force Academy as a youngster. Coming out, thought I wanted to be a fighter pilot, and went through pilot training, at least the initial part of it. Loved that part of it, but really fell in love with medicine. I was a college football player, so got the opportunity to play for a great man in Fisher DeBerry, and so when finishing up there, decided that I wanted to go into sports medicine. So left there and went back home to Seattle to the University of Washington, where I did my medical school, did my residency training in Arizona, and then did my fellowship at Steadman Hawkins in Vail. Then I was lucky enough just to go down the road a little bit to the Air Force Academy in Colorado Springs, where I'd been a cadet, and I went back there and was chief of sports medicine there for about 10 years. When I was a junior, I was a linebacker, and Air Force is always undersized, right? So I was playing against guys that were a little bit bigger and I may say a fair amount more talented than I was. So you take a little bit of trauma. My wife would say head trauma, but I did have bilateral shoulder separations, which we managed. I was lucky enough to have to get out of there without any surgery during my playing career. I had to have my neck fused a few years down the road afterwards, and that really gave me a perspective on things. I think, though, most importantly for me is I had a teammate injured, somebody I was very close to, and I think my decision for going into medicine was watching him rehab after an ACL injury and how bad he wanted it, and he was able to get back, and on the first game back, after a year of rehab, he retore it. And that had a profound effect on me and my teammates, and I think that maybe as much as anything, steered me away from pilot training as a career and toward medicine, because I always felt like, gosh, there was something just inherently wrong about an athlete who wants to get back and we couldn't do it. He wasn't able to do it. So my background is in mostly knee and shoulder. I've done a lot of hip arthroscopy and elbow work as well, but shoulder and knee are primarily the areas that I concentrate on. You are somewhat of a product of your environment, and again, coming from a military background, shoulder instability is something that we probably see more of than any other population in the country. And so our experience with whether it's anterior shoulder instability, posterior instability, bone loss and shoulder instability is something that most military surgeons have a lot of experience with. We were fortunate enough to do a lot of research and basic work in understanding the process and how to get patients back on the battlefield or back on the athletic fields with that. The other areas would include things like rotator cuff pathology and advanced arthritis. All those old soldiers grow up someday and they get older, and so they have the pathology that goes along with someone who's worked their whole life and been active. And in that regard, you have to understand the pathology that goes along with those patients as they age. And so one of my particular interests is in caring for that middle-aged or aging athlete, if you will, trying to keep that young person at any age active and going, both with non-surgical and with surgical means. So we do a lot with that. The knee has a corresponding area, certainly with taking care of a young athletic population. The anterior cruciate ligament or the ACL injury is certainly something that is really common in our populations. A patient that comes to see a physician should first and foremost hope that that physician will listen and understand their particular perspective on their condition. There are many patients with the same pathology will treat differently based upon a patient's perspective and a patient's preferences, provided that those preferences are all within sound medical judgment. I think the ideal goal for us as physicians is to always balance that desire to be on the cutting edge and innovation and new approaches to patient care while at the same time not losing the perspective of communication and listening to their perspective. So when I left the fellowship with Dr. Hawkins, my first job was to go down and look after some of the teams at the Air Force Academy. I arrived to my new base on around September 1st. Sure enough, 10 days later, September 11th happened, which changed our whole country. Certainly changed me as the military let word out. We didn't even go home that day, and I was off on a plane very shortly after to Pakistan. And so I was lucky enough to serve there with a special operations group as well as a conventional group there that was in the early struggles with the war on terror. And then I redeployed again to Iraq in 2006, and I spent another many months over top, and then did a few other missions along the way overseas in that regard. I think they were exceedingly impactful on my life in terms of number one, helping to understand that there's a price that we all pay and need to pay for the society and the blessings that we've been given. Most people don't know this, but we don't send combat troops into combat ever without a surgeon that's there and ready. And so I was very proud to be that surgeon. So I spent 15 years in the U.S. military, and I think that it may have been the single most important thing in my development as a physician. I think the reason for that is that I was blessed to take care of a culture who truly puts service above self. These are young men and women who are more than willing to put themselves in harm's way and to suffer exceeding or extreme personal injury for the sake of their mission and for the sake of the betterment of the folks that they are around. Serving a population like that is something that you really just can't really describe sometimes. The reason I chose Steadman Hawkins to return to was first and foremost begins with their mission. When I first sat across the table from Dr. Hawkins many years ago and interviewed for his fellowship, the thing that struck me most about their clinic and what Dr. Steadman and Hawkins built was the fact that in all of medicine and all that was going on, the thing that was most important to them and most driving to them was the innovation in terms of keeping people healthy and active. And they never strayed from that mission statement. So they never put themselves above the mission. And I think with my background in the military, I think that a mission-centered place that puts service above self and was something we can serve that's a greater purpose than ourselves was really something that hit home to me back then as a fellow, and has continued to be the mission with Hawk and with the group here in terms of putting together innovative approaches to research and education. So when my time was finished in the military, I jumped at the chance to come back. I'm married. My wife Beth is certainly the far better half of our family parenting unit, if you will. We've been married since the year 2000. Met in my residency. She has been tremendously supportive, being in the military and serving several tours overseas. We had our first child in 2001, and about 4 months later, I was on a plane to Afghanistan, and she learned firsthand what being in the military and being a military spouse was all about. Really, the sacrifices that the military families really undergo are far more than the soldiers that go over and serve. And she's been a mother and father many times to our kids, so she's been fantastic. I have 3 beautiful kids. My oldest, John, is 13, got an 11-year-old Mia and a 10-year-old AJ. All of them are doing all the things that you like kids to do. We're very blessed. They're all very active in sports in our off time. The boys love every kind of sport, and Mia is probably maybe the most talented of all of them athletically, and but she enjoys maybe a little bit more of the artistic side of things, and so she helps stretch my mind and brain and helps me learn a lot about those other aspects of life. I'd never lived in the Southeast before. I've always been out west. Most of my exposure with South Carolina came because I played in college for Fisher DeBerry, who'd been a Wofford graduate and coach and grown up in Cheraw. And he talked about it for years, about how beautiful it was out here. And so when we heard about the opportunity and got a chance to come visit, I thought, well, this will be great to finally get to see what Coach DeBerry's talked about all these years. And honestly, it's a perfect fit for us. Greenville's got all the amenities of a really large city, and yet it still has a really small town feel. It's got the ocean nearby and the mountains close by to get to, and so and the lifestyle is right in line with what we love to do as a family. So we love that balance that Greenville seems to have been able to achieve, and so we're learning a ton about the area, but so far everything we've seen, we love it here.